We speak. Our words. We listen.
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 That's the ground rules. I'll try this with a introduction in a minute, Ramon, but just give us a sense of what you think would be useful to talk with us about today.
Oh, there's a lot I would like to talk about. I've just read a letter of response to the chair of the cross-party group for autism, Alexander Burnett, from the Minister for Social Care, Mental Wellbeing and Sport, Marie Todd. I'll expand on that as we talk. I think, broadly speaking, I hope an informed discussion on the previous Scottish strategy for autism that ended in 2021 after 10 years, and the proposed diversity bill proposals. And if you want to expand on that, then I'm perfectly willing to do so.
Welcome back to another one of our conversations here at autisticradio.com. The Spectrum Voices team, part of Autistic Association, the entirely independent autistic charity, have the opportunity to speak today with one of our leaders in autism. Autism Leads exist in Scotland. Ramon Hutchinson. Ramon has an actual personal link to autism through his family, and we're going to be asking about the politics. I know one thing, and I know that there was a 10-year strategy in Scotland that was developed by lots of professionals spending lots of taxpayers' money, and it got heavily criticised. It looked like a 10-year gravy train for me, because many of the professionals just used it as an income. And what it looks to me as an autistic person is very little was achieved at the end of it. Is that too challenging for me to say that, Ramon?
No, not at all.
What went wrong?
I think, at risk of being overly simplistic, I think that we had a top-down strategy rather than a bottom-up approach. As you rightfully said, I mean, I think there were a lot of movers and shakers who were involved at kind of higher levels, what we would call the engineers, rather than the allies and the drivers. But the engineers who kind of set policy, who think that they know what's best. You know, they talk about the road to hell being paved with good intentions. I think there were many good intentions underpinning the strategy. It was initially a proposal by an MSP who actually comes from our authority. I met her personally, and you know, she was doing her utmost to try and put forward a strategy that would make some impact and improve the lived and living experience of our community. But it didn't do so. And I think it didn't do so because there was a lack of genuine collaboration. So
I saw some of the collaboration that was attempted. I saw forums created, and I saw consultations created, and they looked like, to me, a justification for somebody's income. It looked to me like a group of autistic people would be brought together, and because that person had that group, that would give them some kind of authority and justify their income. Does that sound familiar?
yes. Aye. And you know how passionately I feel about the need for mandated or mandatory duties as opposed to discretionary powers. And I think that almost all of the Scottish strategy for autism from 2011 to 2021 was predicated on the goodwill of those who deemed to, you know, provide services, as you mentioned. There wasn't mandated duties. that it was not a rights-based approach. And I think it was a watering down of earlier proposals to have a much more revolutionary kind of approach through legislation. And I have fears that, something similar might be happening as we speak.
So, in simple terms, from my old-fashioned looking at television programs from the 1970s and 80s, like Yes Minister, the intention was there at the beginning, but the status quo managed to quash it, and people earned a good living in the meantime. Yeah. What's the new improved version that's going forward now? Different name, same people, same characters, same result?
I sincerely and passionately hope not so. The LDAN, the Learning Disability, Autism and Neurodivergence Bill, I think has taken a very, very detailed approach. I think the civil service who are supporting the Scottish Government have ensured that the lived and living experience is being put front and centre, and that things like LEAPs, lived experience advisory panels, are going to be consulted. Jules, I think that what happened with the LDAN bill is that it was extremely ambitious, and it was so broad-ranging and so detailed. I was reading something recently, a book by Johann Hari about stolen focus. He was talking about how systems get crashed by people who want to infect it, and it's a denial of services, and the system is overwhelmed by information. And I just have concerns that this LDAN bill was similar to that. It was so detailed and so broad-ranging that for a community that already is labouring with a significant cognitive load to just get by their everyday lives, to then be presented with consultation with 14 plus different specialist areas to answer on, was just completely overwhelming. It could have been hugely, hugely simplified. And as a consequence of that, I referred earlier to a ministerial letter to the chair of the cross-party group on autism. And one of the things that she said, this is my words, no hers, we want to play for time until actually legislating, because not everybody answered all the questions. Now, that was in the very guidance that was provided for the community for that very consultation. It was specified that not every area would affect every individual or every organisation, and they could select the ones that would impinge on them directly. Now the Minister is saying, delay this, because not everybody answered all the questions over a 4-month consultation period, which seems to me pretty contradictory.
Well, I'll give you a personal anecdote. I had every opportunity as an autistic person with intelligence who has a platform here and who can speak and string a few sentences together to take part in the LDAN. And I didn't. I thought, this just looks like one of those times where the lawyers collect testimony after testimony and create file after file and box after box of information and then bury everybody in it so that nothing changes. Nothing is simple enough to change. And it always looks like an intentional, purposeful thing to me.
I can understand that. That's my great fear. Yeah. Yeah.
There's also something about the inappropriateness of reaching out to autistic people, isn't there?
Yeah.
How do we get a platform which makes it actually enabling for the communication differences of autistic people to be respected and get the information out of them? How do we change it? Because at the moment, it's not accessible to me.
Absolutely. And I think that that's one of the reasons why I exist, is to try and be an intermediary of some kind between that complexity, that bureaucracy, that strategic kind of overview and translate that into understandable terms. You're absolutely right. You're absolutely right. So, for example, Jules, within the analysis that was published by Wellside Research after the 4-month-long consultation, after a year's earlier pre-consultation consultation, and a scoping exercise, what areas needed to be looked at. And I think there is great merit in many of the areas. I just think it was overload, as you mentioned, and I think it was far too much to ask the community to answer on. There were some simple premises that could have been distilled, a rights-based approach based on some kind of legislation that would enshrine the rights of learning disabled, autistic and neurodivergent people to access services and supports, and to do that through the formation of a commission or a commissioner. Now, in the consultation, 2/3 of everybody who responded, 65%, said, yes, we want a commissioner, and yes, we want underpinning legislation to allow that commission to have teeth, to be what I describe as a watchdog, no another lapdog. Essentially, for me, that was the big issue that should be emphasised. But within the whole report, Jules, it was as though the 14 other areas of inquiry and the various comments, the various proportions of the population about caveats and qualifications and concerns and contradictions, they were all overemphasised to the detriment of the big issue. 2/3 of the community said we want legislation and we want a commissioner.
Can I share my experience of it? I certainly set a rights-based approach. I always do. I always put for things are actually tied to a committee. I actually said no to a commissioner because commissioners, in my experience, commissioners decide by themselves what they're going to do, and anything you raise and they tell you is not in their remit. I don't see commissioners as accountable enough. Directly participate in lived experience boards. That's better if what you say gets into the record where you can find it again, but I'm wondering, will they have the same problem as the subgroups had in the strategy, which was there was no mechanism to new people to them as time went on later. It was just the luck of who got on them right at the beginning. They were then just nicely seated on them permanently.
That's a lack of access problem, isn't it? People have already chosen the puppets from the autistic community. Some of those people that they thought would be puppets have turned out to be much more vocal than they expected, and they don't want more vocal people to make it difficult, maybe.
Yes. I think they try to address that by saying, well, what would a commission look like? Not just a commissioner, but a commission. One of the merits of what they were trying to do, outlining that, or what shape that would take, is having lived experience advisory people and lived experience advisory panels. And you're absolutely right. There would need to be transparency from a community that would say, well, how do these people get appointed? Are they appointees or are they elected? What is the mandate that they have to feed that information back to the community and hear what the community are saying and have that constant feedback loop? Now, my understanding, now obviously it's in the kind of very early stages, is it would be a commissioner who would be advised by LEAP panels and individuals drawn from the community, whether they appointed or elected.
Over in the text, Raymond is using the word dissembling, confusing with detail, disguising. So that always comes around to the way things are set up as consultations, as forums, as panels, as advisory groups. All of these different constructions are all, in their essence, based on neurotypical assumptions of communication. So all of them put autistic people at a disadvantage. So what happens by the look of it is that a few people get to express some things, but the whole framework generally is under the control of people who are being well paid to be there, and they're obstructive.
I believe in the notion of champions. in having locality-based forums. Now, we were promised that there would be, and after the demise of Autism Network Scotland, which was the nationally established organisation across Scotland with the Scottish Strategy for Autism, we were promised after its demise that there would be locality-based forums established. They've not yet happened. They have never, to my best of my knowledge, transpired. So locality-based forums feed that back, and it's not yet happened. So yes, dissembling is an excellent word and very apt. The detail and the broad scope of this LDAN consultation, that it's just been far too detailed. That said, there are many, many areas, in fact, all areas that I agree with, in terms of the 14 areas, things that have never previously been raised, like criminal justice, like the justice service and the gross over-representation of our community in that system. Things like advocacy, albeit that it was very limited to professional independent advocacy. There are other forms of advocacy that I'd like to have seen, given a better platform within that. There's loads of things, with loads of areas within the LDAN consultation that hold huge amount of merit. A commission could then start examining in much more detail without burdening the community to answer each and every one of them.
Yeah, repeating the whole stuff again and again, the burden is what you're talking about. I'm going to give you some inside information if you want, because when you spoke about the 10-year strategy and the Autism Network Scotland as it used to be, it's been changed into something else by one of its directors. That idea of creating forums started again, and they reached out to restart a forum, and I watched it happen over 2 years, that the forum that they wanted to produce to reach out to autistic people, of which I was a part, was controlled by the professionals, and there was very little option for the autistic people to have much that went anywhere after the discussions. Also, the way it was organised was in neurotypical lines. And when we tried to describe a better model and work on a better model, it was appreciated, and we worked the radio model and created that over a period of time for use, and we were praised. But in the background, those same professionals were applying for funding for late diagnosed people that the group itself, the autistic people themselves, having created a charity, could have organised themselves. If they'd known about it, could have used the same funding stream. But the people who were reaching out to create the forums were unwilling to share the information. So it seems to me that the structure at the moment is built so that it's not in the best interest of autism professionals to build constructive partnerships with autistic organisations.
Yeah, after ENS came to an end and the Scottish Government funding was withdrawn, the people who then were left for ENS started their own kind of consultancy business. No mandate from the community, partly as a business venture, a private consultancy business. Blake Sanderson, who were the commission service who reviewed the Scottish strategy, said the Scottish strategy was responsible for stop-start funding, that there was this kind of awful situation where pots of money would become available and organisations would then scurry to try and get access to those pots of money, and they would be funded for 6 months or a year, then come to an end, and the expertise and the experience that had been amassed would be completely lost. That's a major criticism on my part of the issues that we face in Scotland as an autism community. Pockets of funding that become available, it's almost like crumbs from the table of the engineers who give us these funding streams and say, oh, that's become available, this has become available, and then we have to scurry to try and access it, and then after 6 months or a year, it's gone again. So, the supports are not built upon, the experience is not continued. There is no sustainability in that. So, yeah.
Autism professionals, even if they have the best will in the world, they're competing for their income with the change that's coming through, which is autistic people themselves being the professionals, creating the organisations and taking responsibility closer to the grassroots, all the things that people say is needed. The major stopping block for that is the competition between autism professionals and autistic people over money and funding.
Yeah. And I think that a lot of that comes back to things like credentialising, the professionalisation of the entire system. It's only if you've got a PhD or a master's or some kind of piece of paper, that you're the quote-unquote expert on autism, when the lived and living experience is more valuable in most instances. The kind of people with the paper qualifications, who in my experience, many of them don't have a real grasp on the lived and living experience. So yeah, and I think that that's part of the problem in the system. It's only if you have the quote-unquote legitimate qualifications. Stand from a quality assurance perspective, Jules, I can understand that there must be safety. One of the ways we do that is to make sure that people are suitably qualified. But I come back to my old chestnut of the allies, the drivers and the professionals working collaboratively. That communication, that collaboration, that consultation, cooperation and co-production. Mostly co-production. Actually democratise it. Let's co-produce things. And the issue for me about that is that I have encountered many professionals who that particular discourse, that particular community-based asset approach is anathema to them. We have to discover, connect and mobilise with the community, discover the issues that the community has and, connect them together as a community and then mobilise them and upskill them to address those things for themselves. But I don't think we can do that in silos. I don't think the allies can do it themselves. I don't think the drivers, which is the autism community, the autistic people themselves, can do it themselves. It needs to be in collaboration.
Well, I still want to make the statement that as I see it from the outside at the moment, everything is built against what you say happening. The system is there to prevent that. But what people are saying in the chat here, Harry brings up the point. He says, the problem with any consultation is that it feels like a talking shop without any further steps. It's like talking into the abyss. And Ramon says, is there any way we can work the bureaucracy? Or are we, as agents, required to seek self-funded autonomy? This is very like European social funding for representation received by deprived communities. Turn of the century, where, as you say, representatives and activists get turned by the nature of the system. So I think he's saying really that once you as an autistic person, an autistic organisation get into the system, you find yourself so part of the system that you're part of the problem.
A poacher turned gamekeeper. I think we need more autistic individuals within the system itself. I think we need more APOs, autistic people organisations. When I was listening to the comments, our community, sociologists have a wonderful term. It's called MMU, multiply marginalised and underrepresented. And representation matters. We need representation at the very core of the engineering organisations. That's how we can stop the talking shop, tokenistic, abyss-looking processes.
Well, we have a model here that isn't a forum that makes up autistic people uncomfortable, where text is as important as speech, and where nobody who is autistic has to worry about being on camera or all of those kind of things, and it's edited into a digestible format. This is the forum, this audio forum, that could be so useful if it was taken up by the professionals. But it does, to some extent, call people to account, however friendly I can come across, and they don't want to account, do they?
I think you're right. I think it causes discomfort. I get huge pushback, when I offer awareness sessions. I'm not a professional trainer. I've worked as the coordinator here for 10 years, and I offer the benefit of the professional and personal experience that I have when I convey some of the things that you've already expressed, Jules, in those forums. I get accused of being political. Well, I'm not political. If I am talking to health professionals and saying that the biomedical model is inherently deficient and reductionist and unhelpful, and that we need to look in a much more holistic way, kind of biopsychosocial. The overarching discourse is that autism is somehow a disease, and it's not a disease. And when I challenge that paradigm, when I challenge that discourse, I get a lot of pushback and accused of being political. And I think there's a political element of forums like this, and it should be, because it's about informing and upskilling in the truest sense of the word, radicalising in a constructive way the community to be active participants as opposed to passive recipients, doffing the hat and thanking the professionals, giving them crumbs off their table.
Back in the ANS forum, in the last active phase of its life, I made an issue of at least trying to track to the extent of response and take-up to the issues we'd raised. Were where did they reach in the professional world? That hadn't been in the original picture when it started. Professor Dunlop has sort of imagined it being professionals sort of casually networking among themselves and chatting about the things that came up with it, but that hadn't left us with any definite picture that we were achieving anything. And so I raised that we needed one. I don't know whether you think that had any bad impact towards the whole thing coming to an end.
Are you saying, Maurice, that just simply asking whether any of the things that you had said at previous forums and meetings had got anywhere led people to think that they no longer wanted to engage, yeah?
When you're looking at what things were happening in the period leading up to when it gets to CHOP, well, that's one of them.
I think those forums stopped because the people who could previously use them to make it look as though they had a group of autistic people in their back pocket and justify what they were doing based on being informed by autistic people, when they lost the value of that forum for their own means, there was limited amounts of time that they were willing to put into it free of charge without funding. They carried on a bit with us, and we actually continued the forum and asked them to keep coming to the meetings, but they didn't turn up most of the time.
That's the merits of the efforts made after ants had been chopped. That's slightly different to my point, which is about the government's potential motives for chopping ants. And I mean, I meant leading up to that, and the forum certainly still running.
A new point from Raymond, based on what was said earlier. If autism professionals are going to profit from services, then the service users themselves can also piggyback and subvert the services in the other direction. They could hack the spaces available for more variant modes. It always makes me think of the user and the dealer in the drug exchange. Do you want to explain that a bit more, Raymond?
Just finding a way to be in that reciprocal relationship, but in a way that is more open It's just a way that I approach
What is it you're
situations.
saying?
For example, this autistic radio
You're saying it like it's
community
an opportunity.
is a very, very small
If there's money
example of
around
what
for
I'm
the
talking about.
professionals, then maybe
A way
autistic
to
groups
be
themselves
with
should be competing with
others in a conversation. Now, when we look at these other conversations like we're hearing about today and the experiences I've had in the past with, funding for local communities, it can get very frustrating and depressing. Politically, socially, you see people taking advantage. You feel you can't get anywhere. You wonder what to actually support. You wonder about your own agency. So at the ripe old age I'm getting a wee bit tired of all that. And I just think no, you've just got to figure out a more open way to create a space. Now, how that then folds out into the greater community, which is what I think is being discussed, a government-led set of proposals for managing society, then that's maybe a wee bit beyond me, but I'm working from that ground level.
And the other point that Ramon makes is it's all political. When you're being criticised for looking at the wider picture, people call it politics, but it's all political, Ramon, no? So going forward, we've talked about the failures of the past and we've talked about trying not to repeat them. What's the new thing? What's going forward now?
Well, I mean, I suppose the best way to outline that is to kind of outline what the well-said research said were recurring themes in the LDAN, the LDAN consultation. Now, I don't agree with all of them, but it might be useful to just hear them. Number one, they need to include those with a lived and living experience in designing, delivering, and evaluating any changes, strategies, and guidance, inclusive communication, training, or data collection. Very wordy. The need for staff training, overwhelming both in learning disabilities, autism, and neurodivergence, and around inclusive communication. Number three, the need for accessible communication and information to be proactively provided and to go beyond easy read options, which I entirely agree with. Four, the need for advocacy support to be provided, to have consistency in advocacy workers and for them to have appropriate learning disability and neurodivergence training. Five, the concern over funding, which we just touched on, and resource and staffing, and how each of the proposals would be delivered given the currently stretched finances and staffing problems across public sector services. Nowhere does that say how that square could be circled or circle could be squared in terms of using the autistic community itself to augment, to supplement that. 6, the need for robust accountability and real consequences for services not delivering on legal requirements or strategies. 7, a need for clarity around what the LDAN bill sought to achieve that was not covered by existing legislation. So again, complexifying that, saying that there is lots of legislation that already exists, the Equalities Act, the Human Rights Act, the United Nations Convention on the Rights of People with Disabilities, and the United Nations Convention on the Rights of the Child, amongst others. So again, that whole complexification of things. And then finally, the legislative change. That legislative change may not be the most appropriate way to achieve desired proposals. Now, that's what they said, that final point, that legislative change may not be the most appropriate way, because there had been doubts expressed. Later on, in their own executive summary, they bullet point and say 65% of everybody in the consultation supported option 1, create a new commissioner, and that it must be permitted to conduct formal investigations and have enforcement powers, have duties in the legislation rather than just powers, and be responsible for collecting data on outcomes and have a role in promoting and securing rights. So they contradict themselves in their own analysis, their own summary. So that's the way forward. That's what the proposal is. I think the notion of having the lived and lived experience front and centre to that is absolutely the most important aspect of it.
Okay. Can I just clarify there? Are you saying there's a contradiction because on the one hand they say that it might be that there are enough laws in place at the moment without changing the law, and that we just need to apply the laws we already have in a better framework, and that is put against that you actually need to change a law to create a commissioner? Is that where the problem is?
Yes, not for all, but for some who were involved in the consultation, yes. You put it very well, very succinctly, Jules. We should just use existing legislation more robustly and fully, as opposed to creating new bits of legislation. Personally, I don't think that's the way forward.
That fits with me. I believe that all the laws are in there and they're just not being followed. I don't actually think wasting our time spending money changing laws, which costs enormous amounts of money to change laws, and it takes up everybody's time, and that's where all the effort goes into, when we just need to change the framework and the way things are done. We don't need more consultations, more law changes. We need to use the information we already have. You see, to me, changing laws just looks like kicking everything down the road again and saying, right, we're going through a process. It's going to take another 10 years.
Mm-hmm. I can totally understand that. But I personally believe that it's only through bespoke legislation that specifically addresses all these issues that have been raised in this consultation as it relates to the learning disabled, autistic and neurodivergent community. I think that everything else is much, much more diffuse, if that makes sense.
Okay, I understand.
I'll give you an example, Jules. In relation to the mental health reform that has been ongoing for the past 6 or 7 years, we had the Rome Review, which was a fully inclusive consultation with the entire community about mental health legislation, and third sector organisations, individuals, all stakeholders in all areas fed back and overwhelmingly said that the mental health legislation in Scotland was discriminatory, that people who are autistic and who have learning disabled were in the law. Everybody, just because you're diagnosed autistic, you are quote-unquote mentally disordered, as the law presently exists, was discriminatory and against the UN Convention. And then we had...
I'm mentally disordered?
Yes.
Sorry, I am mentally disordered?
Yes, as the legislation currently stands.
Dare the legislation describe me as mentally disordered?
Yes.
Listen to me.
Exactly. Exactly. How dare they? And that's exactly how I feel about that. And then we have the Scott Review, John Scott, Casey, who's fed back to the Scottish Government with his, I think, over 200 recommendations. And it's just befuddled everything. There is a kind of tension between what the community has said unequivocally in terms of reform and the need for reform to mental health legislation and what the Prestos have said about that. And to me, it reads like one was bottom up and the other was top down. Therein lies the contradiction. It's only by empowering the community, it's only by having a rights-based approach and a bespoke piece of legislation that's tailored specifically for learning disabled, autistic and neurodivergent people that we're going to move forward, that those structural and systemic issues that have dogged our community for forever will start to be addressed in a way that's meaningful and no tokenistic.
Wow. I'm going to stop you at tokenistic because you don't, your didactic ending there is beautiful. It is. Is that okay?
Yes.
Okay, you get the last word there. Wow, thank you, Ramon. I think you have summed that up rather beautifully. And the people listening, we've got some links in the program notes. There is a consultation. The consultation has happened, but it continues. The movement the pressure, the need, the fight, the protest, the conversation, the discussion, the openness, the need to be heard and communicated continues. So please, if you are one of those people out there who feel that they can add something to the debate and improve the situation, then take every means you can to do so. Here we are on Autistic Radio with the Autistic Radio model. So if people want to create a forum and really have a full and open discussion in an easy way that's safe for both the professional and the autistic people, here we are. We set it up for you. Just come and join in. Thank you, everybody. Thank you, Ray. Thank you, Harry. Thank you, Morris. And, of course, thank you, Ramon, for speaking with us today here on Autistic Radio. Spectrum Voices Consultations is an Autistic Association sponsored production for autisticradio.com. Thank you to the charity for making this possible. Autistic Radio is personal and it's informal, which means that those taking part speak only for themselves. If they mention an organisation that they work for or they're a member of, they're not speaking on behalf of that organisation. We shouldn't take any implication from that. It's also the case that people's opinions change over time. So while this recording is there forever, people change.